Today our discussion is sexual offense. This is a very important chapter in FMT, that is forensic medicine and toxicology. This is very important for MCQs in NEET PG or FMG or INICT, and also university examination for the third prop mbbs students. Sexual violence is a broad term that includes sexual abuses, sexual offenses, sexual harassment and sexual assault. So what is sexual offenses? It refers to sexual activity, sexual intercourses, interference with a person or any animal against the provision of Indian law. There are so many types of sexual offenses. That is classification of sexual offenses. We know about the older classification: natural sexual offenses, unnatural sexual offenses, paraphilias and sexual offenses. We know first about the natural sexual offenses. Natural means as per nature, that is penovaginal intercourses. In this, in this example, rape, adultery, incest. Another one is unnatural sexual offenses, that is against the order of nature, that is other than penovaginal intercourses. Example, sodomy, where anal intercourses between two men or a male with a female. Another one is buccal coitus, that is mouth, that is use of mouth during intercourse or insertion of penis into the mouth. Another one is lesbianism and bestiality. We know about this in later part. Paraphilias, sexual gratification acquired other than intercourse, that is there is no intercourse. Example, voyeurism and exhibitionism. Another one is sex-linked offenses, that is indecent assault. In this, forced or non-consensual disarming. Disarming means removing of clothes or forcefully kissing, touching, etc. against her will. Now we know about the Criminal Law Amendment Act 2013. This is also known as Nirva Act. This is a law related to criminal offenses against women, and that was completely modified in January 2013 after the Delhi gang rape case 2012. Now we know about the most important topic, rape. This is very important topic for university examination. Rape is not a medical definition, it is a legal definition. So at first we know about the definition of rape. Rape is an unlawful sexual intercourse by a man with a woman and is defined under section 375 IPC and section 63 BNSS. BNSS, what is BNS? BNS is Bharatiya Nagarik Suraksha Sanhita. So by this act, the definition is a man is said to commit rape if he himself or makes a woman to do so with him or any other person the following: penetration his penis to any extent into the vagina, urethra, anus or mouth. Then insertion any object or any part of his body other than penis into the vagina, urethra and anus. Manipulation of body part of the female to cause penetration into vagina, urethra and anus. Application of mouth to the vagina, anus and urethra, provided any of the following. One is against her will, against her consent, that is without her consent. Consent given due to fear of death or hurt. Another one is consent given believing that the man is her husband, that is impersonation. Another one is invalid consent, that is given due to insanity, intoxication, influences, that is under any drug, with or without her consent when she is under 18 years of age, that is statutory rape. And another one is unable to communicate consent. The exception of this definition is medical intervention, that is medical examination. And another one is sexual intercourses by a man with his wife not being under 15 years of age is not a rape. Now we know about the type of rape. There are so many type of rape, that is gang rape, statutory rape, custodial rape and drug facilitated rape. So we know about the gang rape. This is also known as pack rape, when more than one person constituting a group or acting in a furtherance of a common intention rape a woman. Each one is deemed to have committed rape. Another one is statutory rape, that is sexual intercourse with a girl under the age of consent. In India, the age of consent is 18 years. That is statutory rape is below the age of 18 years of the girl. Another one is custodial rape. Rape of a woman by a person who are in position of authority, that is police officer or jail warden or hospital staff, when the woman is under their custody or care. This is known as custodial rape. And another one is drug facilitated rape. Drugs such as flunitrazepam and gamma hydroxybutyrate are referred to as date rape drug, have been used by people to render the victim unconscious before raping them.